I am Stephen Hudson. I live in Redding, California. I was in commercial and industrial work, and as a consequence, I came down and was diagnosed with asbestos of the lungs in 1997. They told me I would have about 2 weeks to live and I should go home and get my affairs in order. I felt that things had ended, and I was still a pretty young man. But I came down to Stanford after a period of time. They said they could do the surgery for me. The third trip, they transplanted me. And since that time, I have been on the transplant medications, and I became in pretty serious trouble with a cancer of my lip.
It's thought that being immunosuppressed decreases your body's innate defenses against cancer. Also, some of the medications that one is required to take to maintain the graft or the organ that's transplanted are actually carcinogenic. Post-transplant patients who develop skin cancers tend to develop more simultaneous skin malignancies, and those malignancies tend to be more aggressive in behavior. The good news about skin cancer is that unlike many internal cancers, you almost always see it coming. We want to catch the precancers and treat them as soon as we can. If some precancers escape and become skin cancers, then we want to treat those as quickly as possible at the earliest stages. Some of our treatments include topical chemotherapy, and we tend to use Mohs surgery. Here we have 2 excellent Mohs surgeons to make sure that we get the best, cleanest margins possible while still sparing skin. In Mr. Hudson's case, he came to us with a history of non-melanoma skin cancer and a number of precancerous lesions, as well as changes that were concerning for cancer on his lip. We biopsied it and it looked like skin cancer, and so we sent him to our Mohs surgeons who did a beautiful reconstruction, and it was significant. He had a good portion of his lip removed, but his results is amazing. We've treated his arms as well as his chest with photodynamic therapy. We've biopsied a number of concerning lesions, all found to be either precancers or very early skin cancers amenable to treatment with topical therapy. And basically what we're doing is just tidying up the landscape, and he's doing really well.
These folks have a tremendous ability to say, you're very, very important to us. Nothing that I have is unimportant to them. I attribute the Stanford dermatology department with a tremendous amount of satisfaction, well-being, knowing that I'm being taken care of.